When I first met the team at one simulation, I said, well, enthusiastic, young, maybe I should give them a listening. And I heard them out and I said, okay, I'm not sure they'll come back to me. Some harebrained ideas, some so-called business ideas. But as I saw them develop this simulator for ultrasound-guided punctures, I realized that they meant truly making our dreams come true, of having something that I could truly use every day and be happy using for training myself and training teams that could then deliver good patient care. And it is here today. Precision, because that is the essence of ultrasound guidance and an ultrasound guided procedure. Bullseye, as they like to call it, because it hits the bullseye and guides you correctly. And what was missing in previous simulators, and that was texture. That's been captured, and that really is the magic of the super precision bullseye one simulation simulator. My colleagues and trainees have often asked me, how do I train for puncture procedures that are ultrasound guided? And what are the rules? I said, well, the rules are that first of all, do no harm. And the PCP&DT Act tells us, do 30 procedures and come back if you're an obstetrician. And if you're a radiologist, you don't need that training. The fact is that 30 procedures is good, but where do I learn those 30 procedures? And the second question, equally important, is can I afford to practice on humans? The third question is, can 30 procedures really be enough, or do I need more? And therefore, really, the only answer we have is in simulation. We need a device which is not plastic and a box of gel, but something that works and feels human, gives the same feeling as when you puncture a human belly, and the feeling that when you aspirate, when you enter a lesion of interest, you feel that, and it should be available, not ridiculously priced, and reusable. And I think we have the answer to that in the one simulation, new simulator, which is super precise and therefore called bullseye. And let's see what this has to offer us. But should be learning in a safe way, and therefore we've been looking for simulators, and our dreams have come true. We have from one simulation a good looking bag like this, which actually works magic. And so when I open it, this reveals for me a bag that has a mannequin, a bag that contains the form of human texture of the abdomen. And through this, with the use of ultrasound, I'm able to introduce my needles and hone my skills, basic as well as advanced, which means I keep it in my practice, and I practice as much as I want. And not only do I do it for practice, when I'm actually getting onto a patient, I can make sure that I can assess, are my needles long enough? Are my needles echogenic enough to be recognized by my equipment? And importantly, I can't afford to puncture my patient twice. I need precision, and that is now available for me. And that's thanks to something like this, which is not a tub of gel with a cellophane wrap and a plastic toy, but a true human simulator. So the simulator I've been referring to is this one from One Simulation. What it does for us is there is a mannequin, feels like a human belly, a pregnant uterus, or an abdomen with ascites if you have to, and you're not working in fetal medicine and you're working in general radiology, for instance. And this is important when you're trying to figure this out in terms of needle path. And you use it exactly as you would, which means you've cleaned it, you've taken the usual informed consent, blah, blah, and then I put some gel on the abdomen. I choose my standard transducer. I place it on the abdomen and I press my unfreeze button. I've got my settings going. I have here a simulated image with two targets, a larger and a smaller. I have, if I can imagine, a placenta in the background. And the aim really is to get to one of these. And then I'll say, okay, let me try with my needle. When I'm doing this, the first thing I would do is that, look, I'm planning to go in from about here. So if I were to do that, I would press and get the same feeling, and you can see my finger at the edge of the image here. And then I said, okay, from that image, for now I will freeze my image and then go ahead and do a measurement from here to here. And I say, look, I do need a needle that is at least 6 centimeters long. And therefore, if I'm doing this, and I were to use this one, I might fall short. My planning has begun already. So this is not just to teach you on how to do punctures, but to plan punctures as well. And then you can do as many as you wish. Because it's not just then a question of using it once a day, and certainly not just on the patient, but more than that. And so if I were to have everything nicely in place, and I'm picking on this smaller one, I press here as I would usual, then I go in and it feels just like the human abdomen. I then go in feeling exactly as I would on the human abdomen, and then as I am going in, I'm able to trace my needle. If I wish to do so, I can actually retrain this, drag it out to wherever I wish to. I'm having difficulty keeping the simulator in that plane. I can work on it just as in true simulation. So that if you were with a patient and you made this error, for instance, you would be in a soup. But this is a simulator and you can afford that. And then you know that yes, I made a mistake of not getting the angle correct. This time I will now try and get my angle correct. I will then make sure that my needle is in the correct plane, and then I will proceed. So therefore, I will withdraw this, and it doesn't matter that you made an error because this is a simulator. That is the essence of using a medical simulator. We don't have enough patients. Our patients require good skills at the point of first care. They can't be traveling all over a state or a district to get the right care. They will die if they don't get the right kind of care. And therefore, I should be able to practice well and make myself perfect appropriately. So let's try again and see that if I were to try from this particular angle, where would I truly reach? If I'm too much to the side, I'm not doing it correctly. If I'm here and I try here, let's see what happens. I'm going right now, getting the same feel. Look how beautifully through the medium I can see my needle. I can see my needle go all the way. I can fine tune the last bit go straight into my target, feel the puncture there, enter the target and aspirate whatever I need to aspirate. The feel is so important at the point of abdominal entry and traversing the medium and then entering the target. And then I can withdraw with exactly the same feel. If with the same puncture I do wish to reach out to another target, I could even do that with a little bit of an effort. And so here enough, because my needle is so beautifully focused thanks to a good simulator, I will be able to achieve that. I will get everything into the image, and then see whether I'm hitting the target. If I'm here, I'm not there. That's not the correct tissue. But if I were to withdraw far enough and practice with this, get a hold of my actual needle tip, align it correctly, only then I'll be able to get it correctly. So my wrist and my eye are getting correctly coordinated. That is the advantage of a truly human simulator, not cellophane and a bucket full of gel and a plastic toy, but truly a target, a needle, a medium, and exactly what I want. And so here I go again, because my pathologist asked for more tissue. I go in there and then I say, all right, here I am, moving my needle in and out like so, and I can achieve that. This is the advantage of simulation, and thank you very much for this particular simulation. Thank you indeed.